How does fever management differ for children and adults? When it comes to managing fever, the approach varies significantly between children and adults. This difference is largely due to physiological factors, how each group responds to illness, and specific risk factors. Understanding these differences is especially important when dealing with common illnesses like influenza, where fever is a frequent symptom. Fever is essentially a controlled increase in body temperature, often triggered by infections like influenza. It serves as a natural defense mechanism, helping the immune system combat pathogens. However, the way we manage fever in children differs from adults. Children, particularly infants and young kids, have immature systems for regulating body temperature. This means they can struggle to maintain a stable temperature and may be more susceptible to rapid temperature changes. In contrast, adults generally have a more stable ability to regulate their temperature, although certain health conditions can impact this. When managing fever in children, careful monitoring is essential because they can deteriorate quickly. The focus is on comfort and preventing complications. Common medications like acetaminophen or ibuprofen can help reduce fever and improve comfort, but they are not used solely to bring the temperature down. Physical methods, like tepid sponging, may be employed, but cold water immersion is usually avoided due to potential risks. It is crucial to watch for signs of serious illness, dehydration, or febrile seizures in children with fever. Pediatric care also includes providing emotional support to parents and educating them on when to seek medical help, as children may not clearly express their symptoms. Gentle care is emphasized, with a focus on recognizing subtle signs of distress. For adults, fever management is often more straightforward. Adults can typically use over-the-counter medications and self-care measures to manage their fever. They can also use physical cooling methods, such as removing excess clothing. Adults should monitor for severe illness or complications, especially if they have chronic health issues. A medical evaluation is usually warranted if the fever is very high, persistent, or accompanied by concerning symptoms. In the context of influenza, both children and adults may experience fever, but children often have higher fevers and more noticeable symptoms. For children with influenza, it is important to ensure they stay hydrated, comfortable, and closely monitored for any worsening symptoms. Adults should also focus on hydration and rest, using antipyretics as needed, but they are generally less likely to experience rapid deterioration solely due to fever. Both children and adults should seek medical care if their fever lasts longer than a few days, if there are signs of complications, or if they have underlying health conditions. In summary, the management of fever varies primarily due to the physiological and developmental differences between children and adults. Children requiring more careful monitoring and supportive care, while adults have more self-management options. Recognizing these distinctions is vital for effectively and safely managing fever, particularly in cases of influenza. Always consult a healthcare professional for personalized medical advice.